Inclusion has been much talked about, understood in various forms, but I think mostly limited in school and colleges. But I think what is very interesting is going to be what after school, what after that, where do they go? Job opportunities are limited or job opportunities don't exist. So how is it that here these wonderful people who are on the panel, what have they done? And let's look at their experiences. So I begin with Alina, if I may call you that. Mitti Café is doing incredible work, right, to create inclusive employment opportunities. Can you share the story about the inception and how did you even get into this?
Firstly, I'd want to start by welcoming two of our lovely team members, Praveen and Caroline. Praveen is our manager at the Mumbai International Airport and Caroline is our assistant manager, and we're very proud of you. So I'll take you all back a couple of years. I was this 22-year-old in college, much like a lot of y'all, waiting for placements that finally will get a job, will send some money back home, and with the rest, party. Simple plan in life. But God had other plans. And in my final semester, I watched this one documentary that changed my life. So in this documentary, I get introduced to Nero. So for those of y'all who might not know who he is, so Nero was an emperor in the ancient Roman Empire. Mighty rich, you see, he would win one war after the other and the other. And one day, Nero wins the biggest battle of his life. And when you win, what do? You celebrate. So he decided to throw a party and he invited the who's who of Tinseltown. He invited kings and queens, princes and princesses from across 7 kingdoms. And as evening befell, Nero said, "Boss, we need some lights to make the party happening." He decided to burn waste to generate light. For him, it was a joke. He decided to burn the prisoners of war and the poor people who were captured, who he considered not more than waste. I was 22 years old then. While my peers walked out, I was there in that same classroom for the next 3 hours contemplating as to what just happened, what did I see? Which is when I realized this one simple thing, that the problem was not Nero. You know, you could equate Nero with atrocities, injustice, discrimination, all the not so nice things that exist in this world that will always exist. You know what the problem was? Nero's guests. As to how thousands of them could sing, dance, drink when fellow human beings burned and died. And at that point of time, I realized that I was one of Nero's guests. That is, if you feel something about anything, and if you're not willing to take action, then you've taken a side. And unfortunately, that side is that of the oppressor. And having been brought up by my own grandmother since I was 2, she had a disability. But all that I could see in her as a child was abilities. And contrary to when I went out into the world, it was very confusing as to how a person's disability and disability alone can define the jobs that they get, the friends that they have, the love that they find. It was so confusing. I decided I will not sit for college placements and very quickly started volunteering with organizations that work in the disability inclusion space, which is when I realized a simple thing. Generally, when we conceive, so I have a 2-year-old and there's a second one coming. So when we conceive, what do we say? That we want a healthy baby. What does a healthy baby mean? A baby without a disability? The problem is not that there are over 70 million people with disabilities in India and over 1 billion people with disabilities across the world. The problem is the larger statistics, which is the disability in our perceptions, that stops us from seeing the magic in their abilities. And I wanted to challenge and change just that. So Mitti Café is a medium to do 2 simple things. One is money should enter the accounts of our lovely team members year on year, sustainably. But more important than that, what are they? So they've been able to, over the 52 Mitti cafes that we had, our first cafe started in a dilapidated tin shed full of generations of rats. 90% of our equipments, right from the spoon, second-hand oven, second-hand fridge, tissue papers were donated by people like you, by the community, people I didn't know. Today we are at 52 cafes and our team members with disabilities have served over 11 million meals and beverages, thereby enabling us to create awareness about inclusion. With every meal or beverage that we serve, they are our change makers in the forefront.
Amazing. I think that is motivating enough for anybody who's here who's willing to give it a shot. Okay, just for my understanding, how many of the participants here are without the background of special education? I can count. Without special education as the background or a therapist as the background. Anybody who's related. I don't see many hands at all. I think we are, what should I say now? Yeah, exactly. Yeah, so I think I'm hoping now the next conference that we have, that will be the biggest change. After being motivated enough that we have enough people from the ones who need to be changed come out here and attend with the same large numbers. I think that would be our national campaign or the promise for this year. Okay, I move on to Sushma ma'am, to you. You have Urban Café. What was your inspiration for starting Café Urban?
I am dumbstruck. We're very small, we're based in Mumbai, but just to back up with a little bit of a story behind know her as well. We came back here because life in the United States isn't as rosy for adults as many people think it to be. We came back here because there was a need here to do something for adults with disabilities who are exiting our school systems. I've worked here as a psychologist for many years and then went to the United States, worked additionally as a psychologist, came back here and recognized that there's a lot more that needs to be done, besides the fact that my own daughter was very lonely in that environment. So we started off establishing Yash Charitable Trust. It's an NGO, public charitable trust, and our vision, as Shyamala has already, I can call you that, right? Has already said, it's a vision that individuals have choices, that individuals direct their future, their lives, and live with respect and dignity in their communities. And so this was a large kind of agenda that we set up for ourselves. What we did know is that we didn't want to establish another sheltered workshop. There were many of those in the city and many of those around us, even in neighboring towns and cities. So we used the 200 square foot space that we had and started a small kitchen. Now this was just by default because it happened to happen. 5 adults with disabilities, neurodivergent adults, worked with us then with a team of non-neurodivergent people, and we set out with our dabba service. I know nothing about dabbas, I know nothing about business. What I do know is that this created a synergy that was unbelievable. Our adults worked with their partners, but worked many more hours in creating dabbas, which there was a lot of love in them, I guess, because people really appreciated it. We got a lot of positive press. We got a lot more people coming our way from sheltered workshops asking, would you take my son and daughter? They love to cut and chop. It's not about cutting and chopping. It's about doing something that's meaningful, that's community-based, and that creates a value for our adults. And that's been our whole focus over the last 10 years. And so from the dabba service, which couldn't house as many people as came our way, we then launched Café Urban. I had heard about Alina, but didn't have the good fortune to meet. But we launched it with the idea of using it as a demonstration of what adults with neurodiversities of a significant nature can achieve and how they can work together along with their non-neurodiverse partners in creating a space that is warm, welcoming. We have individuals and groups from different marginalized communities coming our way to use the cafe space because it's a safe space to be. And just a quick example here is that there is an LGBT group that comes and uses our cafe to meet other individuals and matchmake for themselves because they feel that this is a good place for us to be in. And so that's what it's been. By no means are we able to achieve anything more than what we currently do, but our work speaks for itself because all the adults that we have touched are all extremely happy in their adult lives in the community. They are not in sheltered workshops and not in assisted living. They don't aspire to go to residential homes. They aspire to live in the community, and that has been our primary motive and only motive.
I think once again, an understanding of inclusion in the real sense, isn't it? It's not in a sheltered workshop. It's not separating them and having some so-called safe places for them because they can't handle themselves, but within the community, as a part of the community, without having any difference, parallelly, equally with everybody else. That's fantastic, Sushma ma'am. Sir, now the question goes to you. So, what are the best practices towards the integration or inclusion of people with intellectual disabilities specifically into the broader community? What would you suggest, or what role do you think community-based programs would have?
Okay, before I answer that, you had asked a question earlier that how many participants are here who do not have a special education background, and I had raised my hand. And then I also pulled down my hand thinking that I have a person who is giving me special education for last 41 years. And possibly he thinks I am a slow learner. So he's my son. So he is the inspiration as well as encouragement for me. Now, when you say how do we bring inclusion? Now, inclusion has got different meaning at different life stage of any child. When we talk about a child who is, let's say, 0 to 6 years, for him the most important and the most critical is that he gets early intervention, because that is the basis of his inclusion later on. And the early intervention is not about only giving him therapies or special education, it is also increasing his social adaptability, because that is what will really help him to later on get included or be part of inclusion. Now, we run 6 early intervention centers, small centers in Mumbai, where we get families from slum areas and we provide them early intervention. Now, every month we celebrate at least 5, 6 or 10 children who leave us and they go to a school. That's a matter of great celebration and really satisfaction for us that so many children are going to school every month. Now, we know, and some of them do come back and again go back. So it's a question how much the child is at ease in getting integrated. It is not about the educators or planners or anybody else to decide where he should go. From that point of view, I think our Rights of Person with Disability Act, also the section 31 says very clearly, leave it to the child whether he wants to go to a special school or he wants to go to a mainstream school nearest to his house. So we don't insist on any parent where he should go, we guide them, and finally it is for the child where he gets settled and he settles for the betterment of his life. Now, coming to the employment, now employment opportunities, I would say they are totally different when we talk about urban India, like we talk about Pune, Bombay and such India, and when we talk about rural India. We did a project in one of the backward districts of Jharkhand, that is Ramgarh, which is almost sitting on the coal belt. And the poorest of the poorest families are there. Now, I would say here, they don't know the word empathy, but the community there has got so much sympathy for the children with the intellectual disability or autism. It's really seen to be believed how they are already part of the community. It's only question of joining them again with their families and communities in a purposeful work. So now when we talk about Bombay or Pune, where Pune I live, that's why Pune also comes in my mind. When we talk about Bombay, Pune or any other urbanized environment, here we have to really make an effort that my child goes and he goes into he gets some self-advocacy course and training and then he goes. No, please, if the family wants it, if the family is positive, the child will integrate. It's the family who have to drive, and it's the neighborhood which has to be empathetic about that child. I'll give you another example. My son became inclusive only because I lived in a community where they were so much encouraging him. A person who was so shy, who would not open his mouth anywhere, he was inducted in a bhajan group. There were ladies, old senior ladies in that society, 70 years and plus. Now, of course, I am also in that category only. Now, they just took him along and they said that he will be part of our bhajan group. And within about 2 years' time, he was actually leading the bhajan group. And the kind of inclusion he had and the kind of sincerity we felt within the community about a person who is to be made part of them is fantastic. So I feel that if we want to make a person inclusive, it need not be his job, it need not be his education. What it needs is a community which supports that person. We have started in Pune, where we have gone to almost around 40 cooperative housing societies. Now, if you take the community as a unit, generally a cooperative society is a community. And we have gone and sensitized them about what inclusion is and how the children should be included. And at least 12 of them have employed people with intellectual disability as whatever job they could do in that society. That is inclusion.
Thank you. Once again, very interesting. And the fact I think that you're bringing about is who has to change, or who is the one who is actually to include. It's not them. It's not a person with disabilities. It is us who have to change. I mean, and as I said, I go back to that point. And who are all of us here? People who already believe in the cause. It has to be outside. It has to be with everybody. So I think that's where we need to make a change. So from there, I come to you, Alina. I think, I mean, the stress, I think more about, not because people don't want to work with people with disabilities or people with diversity, it's more because they're not aware or they don't know how to handle, so they are ignorant, and that comes out in various ways. So when you have employed so many, I mean, Alina, what kind of challenges did you face, or did you have any challenges, or how did you overcome it?
Srirang sir and Sushama ma'am, so inspirational. I mean, I'm just already so overwhelmed and charged. So let me answer this question with one simple example. So when Bhairappa's got dwarfism, motor disability and intellectual disability. So when Bhairappa came in, he was rejected at 80 plus jobs, which is post that we got lucky. I remember when he came in barefoot. Today that same boy, if you all happen to go to the Bangalore International Airport, he's the team lead, he's leading an entire team there. But you see, you know, when persons with disabilities come in, for the world to see their abilities, that will eventually happen. But you know what our challenge is? Our real challenge is to show them the mirror to their own abilities after years of rejection, after years of bullying, after years of being told they're not good enough. So when Bhairappa came in, I remember this is almost 6 years back, and he catches hold of me and he tells me, Didi, so when he was born in his village, his mother passed away and he was labeled as a child of ill omen, saying that that baby was the reason for his mother. The reason that she passed away was Bhairappa. And he tells me further that, you know, in my entire life, Didi, I've not had a single friend because people in his village would not let their children play with him. Now, chalo, Bhairappa has become team lead, very good. He was also told something even more painful. You know what he was told? He was told that because of his disability, he will never find anybody to love him. Yeah, we have money or not, love everybody needs. But don't be too sad. So recently I got to meet Mr. Premji, and I mentioned to him that Bhairappa was working at Mitti Café Infosys, Rupa was working at Mitti Café Wipro. So this was the Infosys Wipro love story, and they got married. So we have 30 plus love stories turned marriages at Mitti Café. So love has no boundaries, disability being minuscule. A second example. So generally when we talk about people with intellectual disabilities, right, we say that they're aimless, they don't know what they're saying, they don't know what they're doing. Our experience has been so different. Hemant, he's got cerebral palsy and autism. At the peak of COVID, you know, when all our cafes shut down and we were looking at survival, ki bhai, somehow we'll just survive. Hemant comes to us and he says, and listen to him. This is this boy's vision. Didi, log bhooke hain. There are people who are hungry, and we always see an impact in numbers: 100 meals, 1,000 meals, a crore meals. Always numbers to impact. This boy Hemant, he's got autism. He comes to us and he says that अगर हम खाना बनाएंगे कोई भूखा नहीं रहेगा. This was his vision. We started with a few hundred meals, and today it gives me immense pride to say Catching on to Hemant's vision, our team members with disabilities, all of these amazing people, have served over 6 million meals to the economically vulnerable, thereby changing the paradigm that persons with disabilities, given the right kind of support, can not just support themselves, but support the nation in need. Yeah.
My God, I don't know what to say. I'm stumped. Actually, it's what an amazing piece and what confidence. I think the success I would attribute is because of your belief in them. I think that's the simple thing. That you believed that they can do. You believed that yes, they have every possible way of advising you and giving you the input just like anybody else. And you believed in it, and that's how you are. So once back, one more learning is that you believe. It's not that you are sympathizing and saying, oh, poor thing, I'm doing a charity work. It's actually recognizing them for their ability and not their disability. So I think when we are able to do that, I think we'll go a long way. Okay, now coming back to Sushma, to you. Both of you have Café, so it's like really interesting to know your point of views about that. Did you make any adaptations in your Café for making sure that people with diversity or people with disabilities didn't find it difficult to come in or adapt or work?
So our learning was from our 200 square foot Dabba space, and when we launched the Café, it was with a lot of ignorance, I would say. So we tapped into the community. We had 2 architects who worked with us, and they came over for a meal with us and enjoyed their experience and decided, we're on board. We're going to help you design the space the way it's needed. And so they took it upon themselves with inputs from us as to what we would need. For one, we have a lot of neurodiverse adults who are sensorily challenged. And so it needed to be quiet. It needed to have colors that resonated for them and made it comfortable for them. It needed to have lighting again to address some of those sensory needs. We also have adults who have difficulty with mobility, so it needed to have a lot of room between tables and for them to negotiate the space and so on. Of course, being in Bombay and donor dependent, we had to take a space that was available to us close by. We could not, much to my it broke my heart, but we couldn't make the toilet wheelchair accessible. However, the rest of the Café was wheelchair accessible and friendly. And then everything that we did, the kitchen, the beverage area, everything, the technology we used, a lot of it was dependent on what our adults, well, for one, it was dependent on who was interested in working there. All of them were. But more importantly, it was on what they needed to make it successful. So they needed silent mixers, for example. They needed software in the laptop that they could access and they could, use, user-friendly. They needed, handles on the spoons and ladles that some of them had challenges. So we had to use, different ways, but it was all adapted to suit their needs. And this was very important to us to do it right in the beginning to make sure that we built success. And building success was a lot of direct instruction. A lot of that went into it. A lot of our adults who come to us don't read. They've had interrupted schooling or no schooling at all. And so, having the menu in a different way, in a different format, a lot of visual support, all of these things were very important to build in the beginning, but it absolutely can be done. Alina's demonstrated that. Hundreds and millions of times over. And then, of course, the direct training. So we had to actually directly train. And then the menu was designed by, again, a volunteer food expert who, again, taking into account what our adults could do and design the menu accordingly. And then, again, teaching them how to go and buy the vegetables, buy the raw products that they needed, teaching them where the shops were. All of those things happened with the help of the community. So again, going back to the fact that, when you're in the community rallies around you, it's a win-win. There's no doubt about that.
Thank you. So, once again, I'm sure these changes that have been made in the Café help the others also I mean, it's not only for neurodiverse people. So when you have a different coloring or space enough, it's for everybody. So when we talk about UDL, I think UDL is beautifully functioning here, where you have made those kind of adaptations for everybody. I mean, you thought of it for neurodiverse, but it's for anybody and everybody. Yeah. Did you face any kind of a problem, Alina? No, because I'm continuing with this question. Did you make any adaptations in your cafe or?
So simple things which any other cafe. So I think one thing that I just want to go on record and say what we are doing is nothing special. I mean, what is it? It's a cafe that is run by adults with disabilities. And it's a model that we genuinely believe that can be replicated by any of you all in the room.
Correct.
It's very simple. It's just, I think, basic things that Sushma ma'am mentioned.
Correct.
Basic things. I mean, if there is somebody in your cafe who's got 100% visual impairment, or you're giving training instructions to them, utilize. I mean, there's so much of technology that's available today. There are softwares that will enable them to use the, POS system. Have your menus in Braille. It's so simple. Making a space accessible, I think accessibility is not a privilege. It is every individual's right. And, as much as it's possible, I think one just must make that initiative. Otherwise, persons with disabilities would be in a lockdown for an entire lifetime. And we all must take responsibility for that.
Correct, absolutely. So again, it comes back not just to the hard things that are there, but it's about the feelings and the attitude, which was what right in the beginning, the inaugurals talked about, that feelings are important. So if you think about it, if you will it, it will happen. If you don't will it, then you will have hajar problems in it, or issues with it, and saying ye nahi possible hai, how will we make it such a small place, what adaptations can we make? No, I think it's your thought and your willingness that I come back to you, sir. So how important, see, government has policies, everybody talks, but how important is a collaboration of NGOs, of government, of the other stakeholders to ensure that these kind of things, or people with disabilities, are easily accepted. Right now, I keep going back to the fact that I wished more people, who are not aware of this are here to see their reaction, because that's where the convincing is required. So what kind of things do you think collaborations would work?
Yeah, I'll answer your question, but before that, since other two speakers talked about employment, I also want to talk a little bit about it. Among the participants, can I know how many of you feel that the mothers and sisters who stay at home don't go out for any job, but do the household work and run the family? They also put a lot of value. How many of you feel that? Raise your hands, please. So everyone. But let me tell you, that is not felt when a person with disability, intellectual disability especially, works at home. They are given a kind of feeling of powerlessness, that they are not doing anything, they are not worth anything. But if they are trained, like she has been training for their cafe work, if they are also trained like that and they are put to work in the home and to make the home, they become a very dignified, not only that, but a purposeful member of the society and the home first. We have done that. Now here we are talking about cross-sectional part. A female with intellectual disability or with autism is something which no parents would like her to go out of the house without an escort. And escort should be the family member only. This is the reality on the ground. So what do we do with such female persons with intellectual disability? They are to be taught how to be part of the household and how to become a very, very effective member of the household. And we have tried that in 4 states in rural areas. There are at least 200 women with intellectual disability who are in their home, and they get respect not only from their parents but from their siblings also, because they are doing a very useful work in the home. And not much training is required. Possibly they were already doing that work, but in a very unorganized manner. Here they become organized like their own mother or like their own sister and start working. So please do consider, there are so many special educators here who will go into the field, that is also one of the job, because you will find on the ground parents will be unwilling to send their daughters who have got intellectual disability to go out of the house. Okay, so now I come back to your, can you just repeat your question, please?
That about collaboration or the involvement of government?
Yeah. Now, when we talk about collaboration, we generally talk about awareness, sensitization, and advocacy. Now, most of us do a lot of confusion about it. What is awareness? Awareness is about creating some knowledge about disability. So we generally do it in a wider public. What is sensitization? Sensitization is where you make that person feel that he or she should be doing something about it, something about the disability. And advocacy, you know, this is about bringing a systematic change, maybe with the help of the government. Now, I tell you how we have been doing it, and we have been quite successful in that. Whenever any secretary in the government of India changes, at least last 4 secretaries, we go to him before he gets brainwashed by his other bureaucrats. We talk to him, we tell him what is intellectual disability, autism, and how it is different from other disabilities, and what is to be done about this. And let me tell you, each one have been very, very sensitized about it, and then they start acting. There was one secretary, Shakuntala Gamblin, who straightway formed a committee, and Aloka Di was the chairperson of that committee for person with developmental disabilities. What is to be done about it? So that is, you first sensitize a bureaucrat, and then you advocate. And same we have been doing it for Maharashtra. Whenever there is a change in any disability commissioner and any secretary in the Sachivalaya or Mantralaya, we go meet him, explain him. Without any, we are not doing any advocacy at that point of time. We are just explaining him what is it and what are their strengths and where do they require support from the government. And they have been taking it, and then we are effective about it. To the extent, yesterday, I think Mr. Nitin Patil came here to inaugurate this whole thing. He went to an extent where he told us to write the policy for the government of Maharashtra. And we wrote the policy, and 95% of that policy is today on paper, and government has accepted it 3 years back. So it is the professionals and parents together who wrote that policy, and all of them belong to person with intellectual disability. And of course then there was a lot of public consultation went on, and of course it was made for all the disabilities. So this is what the advocacy can do if you do it in a purposeful way. And next comes, how does the government schemes work? Now, we always say that bureaucrats are not good and they are not bothered and politicians are not bothered. What we have seen is that if you go to a politician, something which a bureaucrat is unable to do it, if you go and convince him with a strength, don't go alone, go about 10, 15, 20 or 50 persons, because they also understand numbers. You go there, take some time, convince them, they do get convinced and they do act. This is what is our experience, and we have been able to get a lot of things done from at political level, and at, you must know what a bureaucrat can do and what a politician can do. Something which you feel is not possible to be done straight away, then go to the politician. Something you say that logically it should be done, go to the bureaucracy.
Thank you. I think once again it clears a lot of things. So it's not as if people don't want to do, it's just about how you put it across to them, and you should know whom to approach for what. I think that's important that you have said. So one last question, I think, is for both Sushma and for Alina, is what is the kind of message that you would want to give the crowd who wishes to start something like this? What is it that you would advise them or suggest to them? Either one of you.
You first. So I'll repeat. What we've done is nothing special. So our first cafe was in a dilapidated tin shed full of generations of rats, remember?
Yes.
So that was the kitchen. And the front touch was basically a small table and an umbrella. And tea flask labeled as tea. The paper, the sellotape, the pen borrowed from the community. So that's how we started. From there today, we are at 52 cafes across the country. At corporates, colleges, hospitals, government offices like the Rashtrapati Bhavan. We had the President of India inaugurating our cafe at the Rashtrapati Bhavan. We had the Chief Justice of India inaugurating our cafe at the Supreme Court of India. But always remember that it happened from that small table and that umbrella. The question remains how. So I'll just divide that into two parts. When anybody asks me, Alina, how has this been possible? How have you done it? I quickly correct them by saying, I'm the most useless person at Mitti Cafe today. I go to Mitti cafes to eat. And the real heroes are the ones who are here, right here, because they absolutely own what they're doing. So a participatory approach, believing in your people. When Sabiha came in, Sabiha's got multiple sclerosis, very severe disability, not much control over her hands or her legs. You must be wondering, so Kirti, if she's on a wheelchair, she can utilize her hands. Sabiha, she has no control over her hands or her legs. So we tried to put her in the kitchen, it didn't work out. Then we realized that Sabiha has got the gift of the gab. You know what that means? If you come in for a 10 rupees chai, she will talk you out of a 50 rupees combo meal. That is her strength. And by the way, Sabiha's outgrown Mitti Cafe. Now she's too big for Mitti Cafe. She has now left Mitti Cafe. She started her own kirana shop, and now our atta chawal comes from Sabiha's shop. So she's one of our vendors, and she's employed a person with Down syndrome. So believing in your people and helping them grow, showing them the mirror to their abilities, ours is the easiest job. Abilities they already have. Will eventually lead to sustainability. And for those of y'all who want to start, if people say that it has to be a very, the idea is everything, please, if you want to even, do the most basic things, it is 99% implementation. Let me repeat, 99% implementation, 1% the idea for success. Second, gende ka chamda, have a rhino skin while you grow. Third, the belief in the power of the community, leverage the power of the community, even this incredible room to grow exponentially. Remember, like 90% of our equipments right from the spoon, second-hand oven, fridge, tissue papers, because I started with zero startup capital, were donated by people like y'all. So believing in the power of the community, and lastly, compassion and courage are two weapons that can eradicate any problems that our world faces today. And y'all, each one of y'all in this room have that in plenty, and that's what you need.
Once again, I think every time she speaks, I have nothing left to say. So I salute. That's all that I can do. Amazing, amazing. I think you should be taking lectures at all the colleges, all the schools, all the government organizations and government offices especially. Come, I'll take you to the state. Because I want to do one course, one training of Anganwadi workers, and then they're not allowing me. Then it's a mandate from the government. So please, I think I should take her with me. So, yes, ma'am.
No, that's fine. I'm going to use my couple of minutes in the sun to say two things. One thing that I absolutely, and YCT is Yash Charitable Trust, absolutely advocates, is that every individual, however neurodivergent they are, has to have agency, has to have a voice, and we have to respect those voices. And I think this is very, very important for everyone, not only in the room, but in the outside world, to understand that they have to have a say in how their life, their adult world is. And too many times, parents are taking charge of this. And that is not right. We don't take charge of our neurotypical kids. Why should we take charge of our neurodiverse kids? So please, if there's nothing else that I say that makes any sense, please take this message out to the parents and families that you work with. It is very important. Mental health among adults with neurodiversities is at an all-time high currently for various reasons. And I speak of this as a psychologist. Work with many, many families where these problems, and they're only being medicated. If we only flip that around to say they are in charge, give them, listen to them, a lot of these problems can be taken away. The other issue I have is, how many of you know about the law? The RPWD. Everyone knows that it exists. Which is the one state that has not notified rules for the RPWD? Can anyone guess? Maharashtra. Maharashtra does not have rules in place for implementation of the RPWD. This is shameful. And I'm just going to say this. I don't know if there are any government officials here, but it is shameful. We have not, and everyone else has rules in place. The Northeast states have wonderful rules, however small they may be. So we have to go out and advocate for this. Why do we have to advocate for this? Because no policy, nothing we put in place can actually be implemented unless there are rules in place. So please, if you have power with the government, we've been trying. We're a small NGO. We've got something in the High Court currently, but as I said, we're small. Please advocate with people you know that the rules need to be in place for our policies to be implemented. The RPWD is well written. It's just that we have nowhere to turn to. How many times I tell families, go to Pune, go and meet the disability commissioner. But there's nothing in place. The disability commissioner will say, "Bichare, ye wo," make those promises. But there's nothing he can go back to because there's nothing there. So please do this on your own individual levels if you can, whatever levels you can, but let's collectively do this.
Thank you. Thank you so much, ma'am. The last one to you, sir. What is one recommendation that you would have for the entire sector?
See, I'll have the recommendation that at the end of the day, each one of us wants to remain happy. And that happiness is what counts in all our life. So all the students here who are, so many students are sitting here, I would tell you that please make the families happy. The mothers who come and leave their sons or daughters, they are one of the most harassed lot in the families because of all the cross-sectional part which we talk about. So when we go on the field, either as a special teacher or early interventionist or whatever, wherever, please take care of the family first. The child will be taken care by itself. Thank you.
Thank you so much. I think I can just sum it up in just one thing when you said, act to include. I think act to include line has been shown very beautifully out here. I don't want to say anything else. I think each one of you have contributed beautifully. And I think the next stage, as I said, one last takeaway from here is to have that national campaign, which will have us then not one auditorium full of special people, special educators and people, but 2 and 3 auditoriums filled with so-called normal people. Thank you so much. Thank you so much. Thank you so much for being here.